What's going on, guys? Welcome back to another video. It's been quite a while since I posted a video, so I'm super excited to be back and making content for you guys. Just to recap, I am currently living in Michigan. My wife and I moved from Utah to Michigan, where I started my emergency medicine residency. And so it's been about 3 months into residency now, and I will talk a little bit more about how things are going in this video. But also I know that a lot of you guys out there are applying for residency, so I'm gonna touch on some important things to think about and to consider as far as residency in general, and more specifically, emergency medicine residency. So if you're an emergency medicine applicant, then you're definitely gonna wanna stick around for this video. And I wanna give a huge shout out to KenHub for sponsoring this video, but more on them a little bit later on. So I will say, guys, it is very weird calling myself doctor now, but I love it. It's such a huge honor and a privilege to be a doctor. It's a huge accomplishment. It's something I've wanted to do my entire life, and now that I can call myself doctor, I feel like I have finally made some progress in this long journey of becoming a doctor. I will say it was really weird, my first couple of shifts in the ER, going into patient rooms and not saying, "Hey, I'm Michael, I'm one of the med students working with your doctor today." Now I'm going in and saying, "Hey, I'm Dr. Mazer. I'm gonna be taking care of you today." And so with becoming a doctor or resident, comes a lot of responsibility. Now those patients are looking to me for answers. So it has been a little bit of a transition going into residency, to say the least. That being said, I absolutely love residency. I love being a doctor. I'm so glad that at this point in my training, I'm not dreading the career choice that I made and the specialty choice that I made. I love the emergency room, guys. As weird as it sounds, I feel very at home and very comfortable in the ER, amongst all the chaos and all of the monitors dinging and patients screaming down the halls. It very much feels like a safe spot for me, but I know that's not the case for all of you guys out there. And I know a lot of you guys are applying for residency right now. So if you guys have any questions about my residency specifically or emergency medicine, then please feel free to send me an email. My email is down in the description. I'd be more than happy to talk with anybody that wants to go into emergency medicine or is interested in learning specifically about my ER residency as well. I will say one of the hardest things adjustment-wise when you start residency, it's not necessarily the medicine. It's actually figuring out your patient's disposition, as well as just figuring out how things work in your department or in your hospital, figuring out the EMR, figuring out like the social aspect of medicine. So how do you discharge someone who lives alone but now needs help at home because they broke their hip or something? Those are the hardest things that I've come to find during my short time in residency. So if you guys are worried about the medicine being the difficult part of residency, yes, it is, a steep learning curve, and you're going to be learning a lot of different, medicines and procedures and stuff like that. But there's also this other aspect of sending your patients to rehab facilities, figuring out how to navigate their situation with your social worker. So I would say that was probably the hardest thing that I'm still learning in residency. Another thing that may be kind of eye-opening to some of you is really how much you guys actually know once you become a resident. You might think you're going into residency not knowing a lot about your specialty or medicine, but I think you guys are going to be truly surprised about how much you actually do know. And I think a lot of that can be attributed to doing your audition rotations. You learn quite a bit about your specialty while doing those rotations, in addition to kind of figuring out if that's a great residency program for you while you're doing your sub-Is. You're actually learning quite a bit of information that is going to help you overall wherever you end up as a resident. There are so many instances now in residency that I catch myself thinking, hey, I remember learning that when I was a sub-I at whatever place. Or I'll remember a specific resident that was helping me when I was a sub-I. So there's a lot to be said about doing audition rotations and doing a lot of rotations in the specialty that you're interested in doing. I know there's some people out there that say as a fourth year med student, do your audition rotations and then kind of branch out and do some other things that may interest you or that may be easier rotations. But I would say I would do as many rotations in your specialty as possible as a fourth year med student. And even if you can start as early as your third or even second year at some places, just get as much exposure to your specialty as possible, because you'll go into your intern year essentially almost like a second year resident, depending on how much time you've dedicated in your specialty up until residency. Like, for example, I would say the majority of my fourth year was spent in the emergency room, with the exception of some required rotations that my school made us do. I was in the emergency room. I was learning as much as I could, because at the start of residency, I felt super comfortable in the ER. I knew what pain medications to order in certain situations. I knew, specific dosages of things that you use in the ER. I knew how to do quite a few procedures already. I had seen a lot of the more advanced procedures that we do in the ER. So I felt I was already super prepared for residency by the time that, I started on day one. But like I said, I was never prepared for that social aspect of residency. Figuring out my patient's disposition, that is something that you're ultimately gonna learn in residency. So don't stress about that. That's just gonna take time. That's gonna take, time in your specific hospital system or your specific department or working with, your social work team. So don't really stress about that. But that is definitely something that I was not prepared for going into residency. Honestly, guys, my residency program is amazing. I love it. I really don't have anything negative to say about it. I think it's a great fit for me, and it was exactly what I was looking for in a training program. We have longitudinal peds, so every time I'm on an EM month, I have 4 to 6 pediatric emergency shifts. It's kind of sprinkled into my schedule. So I'm constantly getting hefty doses of pediatric emergency medicine, which is absolutely vital if you're going into emergency medicine. And I would say if you're an applicant applying for EM this year or in the future years, you definitely want to go to a program that offers integrated pediatric emergency medicine. It's great to do, 1 month of pediatric emergency medicine in your first year. I just don't think that's sufficient. And I think you're going to do that 1 month and you're going to forget literally everything you learned until you go back your second year and do another month. So if you can go to a program that has the longitudinal pediatric shifts, that is the ideal program for you. I promise you guys. You don't want to compromise on pediatric emergency medicine. So guys, I think this is a great time to talk about KenHub, who is the sponsor of today's video. Guys, KenHub is an awesome anatomy resource. Once you get into residency, you're not gonna have a great resource to stay up to date on your anatomy. And so having something like KenHub can really help you stand out, especially in the emergency department where we're doing a lot of nerve blocks and we need to know kind of the anatomy, which would include the muscles, the tendons, the different vessels, and obviously the nerves. It's really good to stay up to date on our anatomy. And this KenHub Anatomy Atlas is such a quality resource. It's one of their new products that they just rolled out. And it's not like one of those massive books. As you can see, look, I mean, it's smaller than my chest. And I think they made it this way so that you guys can take it, wherever you're going, to your clinical shifts, to your, actual shifts as a resident or as a physician. It's a great way to quickly refresh yourself on your anatomy. Now, if you're in medical school, this is a no-brainer type of resource. It's gonna help you do extremely well on your anatomy exams as a first and second year med student. It's gonna help you prepare for the anatomy portions of your board exams. And in addition to their physical copy, they do have an online version of this book, but the actual physical copy has a bunch of QR codes that if you guys scan them, it'll take you to the online portion of KenHub where they have online instructors that will teach you the ins and outs of all the different aspects of anatomy. Now, in addition to the textbook, they have online quizzes that can help you guys quiz yourself to see how much you actually know about anatomy, which I think is a nice touch, especially if you're studying for one of your anatomy exams. But guys, I plan on doing a more comprehensive review of KenHub, so stay tuned for that video. KenHub has also offered all of my subscribers a 10% off discount, which you guys can find down in the description below. And if you guys watch that future video on KenHub, they've given me 6 codes to give out to 6 of you guys so that you guys have KenHub absolutely free. So make sure to stay tuned for that video. Again, thanks to KenHub for sponsoring this video, and let's get back into it. The other thing I want to talk about as far as you guys applying to emergency medicine programs is you guys don't really know what to ask these programs. A lot of you guys, and I was guilty of this as well, is you guys ask a lot about trauma. And it's good to get trauma experience, don't get me wrong. Do you need to go to a trauma-heavy program? The answer for the majority of you is probably no, and here's why. Unless you're going to work at a trauma center, then you don't need that much trauma. You're going to get sufficient trauma at a community emergency program. Obviously, the more trauma you can get while you're training, the better and the more comfortable you'll feel with it. But most ambulances know where the trauma centers are. And unless you're working at one of those centers, you're probably not gonna get that much trauma. The other thing to think about is who's actually running the traumas at these residency programs. Is it the emergency department or is it the trauma service? Because the majority of the time, if you're at a trauma-heavy program, there's gonna be a trauma service that is actually running the traumas. And usually in that situation, the emergency department is in charge of the head and the airway, so you're gonna be doing most, if not all of the intubating, but you're not gonna be running the trauma. Now, I don't want this to be confused with a patient coming in whose heart has stopped and they're actively doing compressions. Like, there's trauma and there's unresponsive patients where they're actively doing CPR. So kind of 2 different categories. If somebody comes in and EMS is doing compressions, yeah, you as an ER doctor, you're gonna be running that. So you're gonna be making sure that their airway is still intact. You're gonna do your ABCs, so airway, breathing, circulation, all of those things. You're gonna make sure that their airway is intact. You're gonna make sure that everyone is doing their job properly. You're going to be still standing back and trying to figure out, why this person is unresponsive or why their heart stopped or why they're in some weird funky rhythm and how you're going to reverse that. But that's very different than a trauma activation. So if you plan on working at a community emergency department, then you probably don't need to go to a trauma center unless you really want to. But yeah, that's kind of like my 2 cents on focusing so much on if your ER residency is at a trauma center or not. It kind of doesn't matter too much. Guys, there's so many things that I can tell you about residency that it just won't fit in this video, but I will leave you guys with a link that really helped me kind of figure out which residencies to apply to. So I'll leave that down in the description below, but it's a Google Doc that people continually update, and it has all of the ER residency programs listed. It has literally all the information about all of them, the salaries. It talks about trauma. It talks about shift length. It talks about, moving stipends and living stipends, and do they offer free food and free parking and all of those little ins and outs. So it's an amazing resource. I'll put some other links of resources that I used to help me determine also, where to apply for residency. So those will all be down in the description for you. Guys, I'm super pumped to keep you guys updated on residency. If you guys have any questions, like I said, email me if you want, drop a comment down below. I'll get back to you guys. If you found this video entertaining and helpful, give it a like, share it to your friends applying to emergency medicine. And let's stay in contact, guys. I'll see you guys in my next video.